Now back to our big story tonight, nursing home deaths in the Cuomo administration. Bill Hammond from the Empire Center, a government watchdog group, was the driving force behind the lawsuit that put the count under the microscope. He joins us now. Bill?
Hi, Emily.
Bill, it's a grim picture, but you say the information put out by the Department of Health this weekend is just a small fraction of what was actually requested by your organization. Now, what exactly are you looking for and how will it help?
Well, what we asked for is more or less all of the data that the state has relating to coronavirus deaths in nursing homes. So we want the number of deaths that occurred on each day in each facility. What they've given us at this point are cumulative totals. And if we wanted to analyze the impact of different policies or practices or events, you need to see the timing of when the virus got worse and got better.
So the DOH does have a deadline to release all of this data, but you said you're nervous about this. Now, in practice, the law gives officials space to postpone fulfilling FOIL requests, and sometimes that stretches out the process many months or even years, right?
Oh yeah, they commonly will defer responding to a FOIL request for months. In this case, they deferred until March 22nd of this year. We started this request back in August. But in the meantime, we filed a lawsuit, and that took a certain number of months to unfold. And then last week, the court ruled entirely in our favor, and that's really forcing the health department to respond.
Now, in the time you guys have been fighting to get this information, New York's had a whole second wave. Do you think things could have been different?
Well, when I asked about this data back in August, that was kind of the low point of our pandemic. Things had really calmed down. The infection and positivity rates were way down. The death rates were way down. Since that time, as you point out, we've had another wave. And this wave hit a different part of the state primarily. It hit mostly upstate. But it was, once again, it was really bad in nursing homes. And I have to think that if we had had a better idea of how bad it got in nursing homes the first time, we might have been better prepared for the second wave. It's hard to know.
Now, the Department of Health has maintained that New York's nursing home deaths rank well below the national average, but you guys found that the new total is nearly 15,000 deaths. That moves them up quite a bit, right?
Yes, I never thought that the comparisons they were making to other states were appropriate because we knew they were leaving out a large share of the deaths in those comparisons. But now we know that the total in nursing homes has gotten about 50% worse than it was. And so that I think that puts a whole different light on it. First of all, it moves us well above the national averages. We're not necessarily the worst hit state in terms of our nursing homes, but we're certainly above average, and it's nothing to brag about.
All right, Bill Hammond from the Empire Center, thank you for your hard work, and we'll be checking back in with you again soon.
Thank you for having me.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.